Drug absorption is a crucial phase in the journey of medications from the point of administration to their site of action within the body. To understand drug absorption, it helps to visualize a process much like a carefully controlled passage through various checkpoints, each influencing the speed and extent to which a drug becomes available for therapeutic use. The process begins the moment a drug enters the body, most commonly via oral, intravenous, intramuscular, or subcutaneous routes. For oral drugs, absorption starts once the tablet, capsule, or liquid reaches the gastrointestinal tract. Here, the drug must first be released from its dosage form and then dissolve in the fluids present, becoming available in a form that can permeate cell membranes. The gastrointestinal tract is lined with membranes that selectively allow substances to pass. Drugs cross these membranes mainly through passive diffusion, a process that moves molecules from regions of higher concentration to lower concentration without needing energy. Some drugs, however, require facilitated or active transport, harnessing carrier proteins and sometimes energy to move against a concentration gradient. Physical and chemical properties of a drug, such as its solubility, ionization state, and molecular size, heavily influence its absorption. Lipid-soluble drugs, for instance, can more readily traverse cell membranes than water-soluble ones. The pH of the environment plays a role as well. Acidic drugs are absorbed more efficiently in the stomach's acidic conditions, while basic drugs favor the slightly alkaline environment of the small intestine. Route of administration significantly affects both the rate and extent of absorption. Intravenous drugs circumvent absorption barriers entirely, entering the bloodstream directly and exerting immediate effects. Drugs administered intramuscularly or subcutaneously are absorbed through the capillary walls at the injection site, a process influenced by blood flow, tissue perfusion, and drug formulation. The concept of bioavailability, essentially how much of the administered drug reaches systemic circulation, arises from these absorption processes. Factors such as first-pass metabolism in the liver, where oral drugs can be partially broken down before entering circulation, interactions with food, or changes in gut motility can all modify bioavailability and, consequently, the drug's effectiveness. Transport proteins in the gut lining, gastric emptying rate, and even modal diseases like diarrhea or constipation can dramatically impact how quickly and how much of the drug is absorbed. Understanding the drug absorption process is fundamental for optimizing dosing regimens and predicting therapeutic outcomes. Medical professionals consider these factors when prescribing medications and advising patients, emphasizing how taking a drug with or without food, or choosing one route over another, can impact the results. In essence, drug absorption is a dynamic journey shaped by the drug's nature, the chosen route, physiological barriers, and the interplay of various biochemical processes. Knowledge of this pathway helps ensure drugs are delivered effectively, safely, and reliably to meet the health needs of patients.